Today we're going to talk about something super fun. It's one of my favorite topics, and I think it's going to be very informative and very helpful for anybody out there who's done Botox or fillers or who's thinking about Botox or fillers. So today's topic of discussion is all of the things that can go wrong with Botox and fillers. So strap in and listen up because this will be very beneficial for you guys. So anybody who, in my opinion, is going to go under the knife or the needle, in my case, it's important to know what can go wrong. So we'll cover that today. Alrighty, so first of all, I'm going to start off with the differences between Botox and filler so that when I talk about the complications, we are aware of hi everyone, we are aware of the product I'm talking about. So difference between Botox, remember, is the neuromodulator or the substance that we use to relax our muscles that frown, our muscles that we have up here, our muscle up here and our muscle around here where we have these lines, okay? Also, we can use Botox to relax our masseter muscle, our chewing muscle, and we can use Botox around the lip area to help soften these vertical smoker lines and also to flip our lip tissue up a little bit. We can also use Botox down here where our chin has like those little dimples, okay? So things that can go wrong when using a neuromodulator or like Botox, Dysport, Juvo, or Xeomin, those are the ones FDA approved for the United States. The things that can go wrong with that are, and the most popular and most common is something called a Spock eyebrow. So this is where we have an over-relaxed glabellar procerus area. So this area in here, it's over-relaxed and we don't have enough relaxation in our forehead muscle to counterbalance that. So we end up with eyebrows that go boop, like up like this, like up like Spock. So most times I get the feedback that either somebody has had a Spock eyebrow before or that please don't make me walk around looking like this. So just know that is a complication, but it's easily fixed. So it's a common reaction that happens with a neuromodulator when the muscle's over-relaxed. So what we do to correct that as providers is we just relax this muscle a little bit more up here in this area, making it so that you cannot lift the brow. So that will help relax that, okay? Now, when you treat this muscle in here, it's the complication that can happen to treating this area of the forehead is the God-forsaken eyelid droop. Okay, everybody hates the eyelid droop. It's otherwise known as ptosis. It is ugly AF. Is no bueno. That is basically when Botox gets into this depressor muscle and your lid goes like that. It doesn't open. So basically your lid goes like this and your eye won't open all the way. Okay, looking like Cyclops. It looks awful. Nobody likes it. It's dreaded. As injectors, we hate seeing it. What typically happens there is an area of no-go to be safe when we're injecting neuromodulator, but oftentimes we get a little bit of, there can be a little bit of product that gets into that area, and then as it spreads in the muscle, it gets into the wrong muscle and creates a droop in the brow. So, in the lid, I'm sorry, a droop in the lid. So that is the number one most unfun complication and unsexy complication that happens with neuromodulator. It typically cannot be corrected, but what can happen is your provider can take a look at trying to lift up, trying to kind of counterbalance the eyelid. There are eye drops that you can use that help to contract the muscle of the eye more frequently to work out the Botox faster. So when you have an eyelid droop, always make sure that you talk to your provider about it. You typically have to wait like 3 or 4 months for the Botox to be completely worn out of your system, and then that problem will be gone. So that complication resolves itself when Botox goes away. But there are things that we can do to help make Botox metabolize a little bit faster, so you don't have to deal with that unsightliness for very long. Okay. Another thing that can go wrong with Botox is whenever the masseter muscle is injected. If it's injected incorrectly, you can end up with an asymmetrical smile. Also, not a happy thing to have to deal with. This incorrect injection and this incorrect injection. Also, when you're injecting up here, anywhere that you're potentially interfering with the muscles that control your smile, if injected improperly, will end up with some asymmetry. This is incorrectly injected, and you end up with an asymmetrical smile. There's no drops. There's no anything really that you can do to help make it work out faster. You just have to wait for the Botox to go completely away, and then you'll resume your natural symmetry of your smile. So although unsightly, also that issue is could be corrected once the Botox wears off. Okay. Another issue that you can have against popular school of thought, although unsightly and we don't like to see it, bruising is a complication, but it is a common reaction anytime we're putting a needle into somebody's tissue where there's vessels and blood. So you can definitely end up with a bruise. Bruising tends to heal in about 4 to 7 days. You can ice the area to help the bruise heal faster. You can take arnica, which is a homeopathic over-the-counter medication that can help heal the bruising and the swelling faster. You can avoid drinking alcohol, taking Motrin or ibuprofen, aspirin, fish oils, any of the G supplements like that ginkgo biloba. Did I say that right? Ginkgo biloba. And and drinking alcohol, also smoking cigarettes. All of those will delay the healing of your bruise. So if you're doing any of those things, just don't do them, and your bruise will heal just fine. So again, complications with Botox is the masseter muscle, asymmetrical smile, droopy eyelid. Nothing you can do about those but wait until the Botox wears off. If you end up with a spocky eyebrow like this, easily correctable. Don't walk around with one eyebrow popping up and this one not moving, or both moving. Go see your provider. They can fix that very easily. Okay. If they tell you they cannot fix it very easily, come to your girl. I got you. Okay. Let's see. Thank you for taking the time to answer all this. You're welcome. You're welcome, Nancy. My pleasure. Let's see. Was there another question I missed? Anybody on the Facebook?
Yeah, Norma Dosha say you ladies are the best.
Am I doing it right here? No sé dónde me encontró. Okay, sorry, I'm technologically handicapped, y'all. I'm getting there, but okay, so next thing we'll talk about is complications that can happen with filler. Alrighty, again, bruising. Bruising can happen anytime we do an injection with a needle. Not a complication. It's an expected response or outcome. However, we don't like it just as much as you don't like it. We hate seeing it. It breaks our hearts anytime we see somebody bruise. But it is a risk you take when you are allowing us to put a needle in your face. More serious things that can happen with dermal filler, and the most serious of all, is called the vessel occlusion. What happens when a vessel gets occluded is a little bit of product of the dermal filler goes into the vessel, prevents the vessel from carrying oxygen to the tissue, thereby basically occluding the blood flow in the vessel, and you'll have some external issues with that. You'll see some potential skin changes. Ya más bien, okay.
La última. Yeah.
Okay, I got it. You'll see some potential skin changes. You can potentially go blind. There's a lot of things that can go wrong when using dermal filler incorrectly. However, having said that, typically a vessel occlusion can be resolved if it is acted upon quickly. So if you're noticing pain that's not going away, changing of your skin color like a blanching or whitening of your skin, a bruise that doesn't seem to be healing at all, and you're doing all the things I said to avoid, come see your provider if you're not seeing an improvement, and we can dissolve it. We can dissolve the filler with a substance called hyaluronidase, and that should recover. It will dissolve the filler, and when the filler is dissolved, you should have regular blood flow back into the vessel, and typically you can heal very quickly from that, and whatever external issues were happening tend to resolve. Okay, so do not hesitate to get help and talk to your provider if you're dealing with an occlusion or a bruise that won't heal or anything like that feels weird. You know your bodies, you know what isn't right. Now, if you're using a non-hyaluronic acid dermal filler, such as Sculptra or Radiesse, there's a couple other ones, those are the main ones, but if you're using one of those two fillers, those are a non-hyaluronic acid dermal filler, so they do not have an enzyme we can dissolve to eat the filler. So those, you have to see your provider about those. There is sometimes a little cocktail that we can do to kind of inject into the nodule and hope that the nodule will kind of dissolve away. But if you always contact your provider and we can definitely help you with that, okay? Last but not least, a complication that can happen with dermal filler is migration. So migration of a product happens when a product is improperly injected or injected into the wrong plane, okay? Migration can typically be dissolved also. It just kind of depends on what's happening. Most commonly, we see migration of dermal filler around the mouth area, resulting in an overfilled upper lip or duck look. That's the most common thing that we see with migration of dermal filler, okay? But it can happen anywhere that we use a dermal filler. Another area is under the eye. When we get those puffy bags after under eye filler, oftentimes the product is not in the right plane, or perhaps you have a lot of filler in there and it's just pushed itself up to the surface, okay? So I'm getting the cue to wrap it up. Thank you for your support. Thank you for your questions, and we will see each other next week. Bye.